Hey guys, we are picking up where we left off yesterday when we're talking about the different additives there are in the vacutainer tubes. And so we're going to continue that discussion. Yesterday we finished talking about we talked about the non-additives like this. We've talked about I can't reach them, the serum separator tubes that have the thixotropic gel, and so forth. Today we're talking about ones that have liquid or a powder in. A lot of these are anticoagulants, which are things that will make sure that the blood does not clot. For whatever reason, when they're doing the testing, they have to have the plasma, which is the liquid portion of the blood with the clotting factors in it, in order to do the test. And there are quite a few, and you need to be able to tell me the additives, what color tubes they go in, and so forth. So the first one is EDTA, which is an abbreviation for ethylene diamine tetracetic acid. You can see why we abbreviate with EDTA a lot quicker. What it does is it prevents the blood from clotting by binding to the calcium and forming a potassium or sodium complex. These tubes are lavender. The most common tests that are drawn in these are CBCs, so the complete blood count. So that would include a white blood count, red blood count, hemoglobin, hematocrit, all those things that are in it, as well as a reticulocyte, which is a test that we do to see how many immature cells are coming into the bloodstream. Next, we have heparin, which happens to be what this one is. It's a green top tube. By the way, back with the EDTA, it is lavender, so you need to know that. Some people call it purple, but most people do call it lavender. The heparin is typically in green. There are different types of heparin. There's lithium heparin and sodium heparin. This one happens to be sodium heparin. Some tests require lithium, some require sodium. So it's your job as a phlebotomist, if you ever become one, to know which goes in which. The way this works is it prevents clotting by inactivating the thrombin and thromboplastin. The tests that go in here are electrolytes and ammonia tests. And actually, that's according to your book. Actually, the Fulton County Medical Center, they use the majority of their chemistry tests in the green top tubes, believe it or not. That's something that's a little different than some other places. It's however their machines are set up. Next, you have sodium citrate, which prevents the clotting, again, with binding to calcium. Your book says that they are royal blue, but I would not call this royal blue. I would call that light blue, and most people do. What testing they do with these are the prothrombin time, or PT, or the APT, which stands for activated partial thromboplastin time, or the PTT or APTT. So those go to the coagulation department, if you remember from our earlier chapters. Next, we have sodium fluoride, which prevents clotting, again, by binding with calcium. So there's 3 already that prevent for binding with calcium, but they all do it in a little bit of a different way. These are great top tubes, and these are typically used for glucose testing. I do not have any of those to show you. The ACD additive, or acid citrate dextrose, is a special type of tube that maintains the integrity of the red blood cells, and these go in yellow tubes, not the serum separator yellow, a different type of yellow tube. And last but not least, the last additive we have is SPS, which stands for sodium polyanethylsulfonate. Again, you can see why we abbreviate. And we use these to determine if there's bacteria present or an infection in the bloodstream. Basically, we're going to draw these when people are having some kind of infection and we want to see if it's gotten into their bloodstream. And they have a very, very special kind of tube that I'll have to show you a picture of. We've talked a few times about a vacutainer, but the place where we put the needles in, that is the adapter. You might hear it called a vacutainer or whatever, but when we say adapter, this is the little plastic piece that you put your needle into that we're speaking of there. Now, all these different colors of tubes, you can't just, oh, I want to draw this color, then this color, and this color. There is a very specific order in which they need to be drawn. And so in order to become a phlebotomist, you need to draw them in that order. You'd have to learn that order. And the reason for that is it prevents cross-contamination between the additives. Excuse me, so that the tests don't get interrupted or messed up in any way. So that's all we're going to do for today. Tomorrow we'll finish up the chapter. We're talking about the other kinds of systems other than the vacutainer, and about the actual procedure of drawing blood itself. And then we'll review and we'll have a test. So we will see you then, and I'll talk to you later.